Hi, my name is Woongjin, a bachelor student from University of Washington. And first of all, I would like to thank you to invite me here to be with you guys. My topic is investigation of the relationship between brain and visual impairment. This project, approach to this project has been guided by the following questions to better understand how the damage to the eyes could be linked to the neurological injuries to the human brains. First of all, what has been discovered from published studies on the matter? And secondly, does the use of computers influence the human brain and ultimately vision? And thirdly, how could we use the brain-computer interfaces to improve any treatments for vision impairments? And this is just the data of the population of the vision impairment and blindness. About 2.2 billion people are visually impaired and blind. Among these people, 1 billion people are visually impaired, and they are able to, they were actually avoidable and still need to get treatment. And in these 1 billion people, most of them are distance vision impairment, and almost 80% of them are near vision impairment with the disease of unaddressed presbyopia. And the study used MRI and VBN or DTI to study the different eye diseases. And by using MRI, the visual pathways the changes in visual pathways are seen, and the thickness of gray and white matters could be seen in the neurological images. And the research were done with different gender, age, and race, but there was no significant difference found in this group. And the researchers also tried to see, the neurological images could be used to see the changes, but it was not certain if the disease occurred first or the change in the brain occurred first, or if they occur simultaneously. And the researchers also tried to see if the degeneration is reversible, but it was not verifiable due to lack of evidence. And although some studies found reversibility occurred in AMD patients, it does not imply reversibility is possible. And there are a lot of technologies to diagnose and give some treatment for those who have suffering from vision impairment. And Goggle is a wearable device that helps patients and doctors to record the performance of a patient's eyes and diagnose if the patient has glaucoma disease. This technology has greatly shortened the time for diagnose the glaucoma from about 6 to 8 years to just a few weeks. And it is using dry EEG and EOG with a head-mounted display. On the right side, you can see the result of the glaucoma disease patient and the control group. With impacted with glaucoma disease, the black and gray parts indicates how the glaucoma disease is impacted the human eyes, where it is less sensitive than the white part, where it is healthy. And below the chart shows that the comparison between the healthy eyes and the glaucoma eyes from the EEG result. And overall, it can be seen that healthy eye has a higher sensitivity. And there are, other than that, there are 2 technologies in the market that helps with people to see the world. And they are BrainPort and Argus II. BrainPort both of them uses a camera in front of them to capture the images and transfer the information to the electrode, either through mouthpiece, which is for BrainPort uses mouthpiece, and Argus II use the implantation into their eyes. And BrainPort, the mouthpiece, using the mouthpiece, the patient can feel the shape of the object by the electrode, and it's just like how blind people use their hand to view the object. And Argus II uses the camera to transfer the information to the electrode in the patient's eye on the retina, and then see the light pattern and the shape of the object the camera captures. And in conclusion, that although BCI is available in the world, but it is still not mature enough to understand more how human brain function and how the disease affects our brain and eyes. Thank you.